Welcome to Mindfulness for the Soul, your daily dose of mental health insights, with your host, John Silamparis.
We all know that anyone can feel the negative effects of isolation for prolonged periods of time. We also know that today, practicing social distancing is critical for preventing the spread of the coronavirus and for easing the load on the healthcare system. But for people that are suffering from mental health conditions, such as depression, anxiety, and many more conditions, isolation can be a very risky time with frightening effects. In short, social distancing has the potential to worsen things for those who are already isolated and lonely. It could actually elicit deeper symptoms of depression and increase the alienation most people with mental health conditions already feel. The medically endorsed social distancing could also spike their anxiety about interacting with others and promote even further emotional withdrawal. So yes, we are indeed doing our best to prevent infection, and we must. But social distancing may have devastating consequences to many groups of people. The elderly are also affected. Not only are they at high risk of suffering serious medical complications from the coronavirus itself, but they are at high risk via social distancing too. Many elderly, as we know, need personal care around the clock due to chronic illness. They also have suffered a loss of friends and family, and also sensory impairments that prevent them from communicating effectively. So for the elderly, being alone is dangerous. Let's remember, human beings are social creatures. We have evolved over the millennia in a bubble of unavoidable interdependence with each other. That's how we cope. That's how we cope with adversity, tragedy, catastrophic events, even events like the coronavirus pandemic. Social distancing challenges our fundamental human instinct to jointly seek support in bigger groups, whether it's family, friends, or neighbors. We don't live in a vacuum. We need each other. In the past, when humans have faced disasters and calamities, people relied on a sense of mutual experience and a sense of community to process the events. The 9/11 attacks in 2001 was an excellent example. The cooperative support in numbers has always proven to be the most effective. Collectively, the human spirit is more apt to be inspired when we rally together for a common cause, especially if it's a life and death one. One of the reasons is that social engagement and the irreplaceable company of others can cushion the negative effects of stress and trauma. Research shows there is a strong parallel between social connectedness and stress responses. The care and comfort of another person is often enough to diminish some of those responses. The care and comfort of another person is truly irreplaceable. Since this pandemic took off last week, we are being told to avoid contact with others by staying at home. It's creating what's called cognitive dissonance. In this case, it's when people are torn by two contradicting beliefs at the same time. Depression treatment says, get out of the house, go exercise, socialize with people, seek support, and try to be in nature. But because of the coronavirus, we are being told to socially distance ourselves, stay at home, and self-quarantine. Also, for many, physical activity and basic movement in general is vital too. For example, it's very important for those affected with mental health conditions to be active, like going for a walk, going to the gym, going to meet a friend at a cafe. All and any activity can be beneficial to lowering the potentially negative effects of loneliness and excessive worry. Staying at home alone could over-magnify the crisis, increase anxiety, and inspire profound feelings of hopelessness. Another reason why this social distancing is a problem. As of today, we don't know the effects of short-term isolation. However, we do know the long-term effects. Chronic social isolation over a long period of time can lead to heart disease, high blood pressure, Alzheimer's, dementia, low self-esteem, depression, suicidal ideation, and even deaths. Chronic loneliness can impair your immune system and leave you vulnerable to disease. It can also boost inflammation, which can lead to arthritis and diabetes. So imagine having a pre-existing mental health condition on top of that. Very scary. The question is, can our current forms of modern communication make up for some of the drawbacks of social distancing? Can texting, making phone calls, sending emails, and video chat platforms like Skype, FaceTime, and Zoom help the situation? And if so, is it enough? We are very lucky to live in an era where technology allows us to see and hear our friends and family even from a distance. However, despite this modern technology, and we are very grateful for it, it cannot replace face-to-face interactions. It cannot replace the loving energy that is transmitted live from one person to another. It cannot replace the warm facial expressions and especially the tender, compassionate touch. Yes, we are a high-tech society, but we are also a high-touch species too. Nonetheless, for now, it's the best modality we have to stay connected. I and many other mental health clinicians have switched over to treating our patients and clients via telemedicine or teletherapy. For now, it's the new norm. It's the next best thing to making sure we are available to those that need our help while positively contributing to preventing the spread of the coronavirus. If you are alone right now and you feel shut off from your everyday supports, please reach out. Don't underestimate your ability to handle this alone. Don't wait for the crisis to blow over anytime soon. We are told that this process could take months. As mentioned in this podcast, humans are not well equipped for isolation and lack of personal contact. You are not an exception. It's very, very important to stay connected. So, hang in there, everyone. We will get through this. And thank you again for listening to another episode of Mindfulness for the Soul. Thank you for joining us. My name is John Silamparis, MFT.